And we feel like we've accomplished a huge amount in our first half of our alternative quality contract.
I would say this is an example of where Blue Cross's leadership really results in better care.
So the alternative quality contract is a special new type of contract that Blue Cross Blue Shield developed to work together with provider groups to really focus on a higher provision of quality care.
Well, the contract is a way to support us as a physician group to help provide better care for our patients and care at a lower medical expense. What the AQC does is to provide us a global payment, which is very different than the traditional fee-for-service model. And the global payment allows us to plan and coordinate care and provide services that we can't traditionally do under fee-for-service.
So we've actually implemented a lot of different kinds of interventions and changes to our care model to help support some of these AQC improvements.
I think one of the problems in healthcare, particularly under the fee-for-service model, is that we only manage the patient who is in our exam room, but what that misses are all those patients who never came in or who didn't follow up.
There may be a lot of in-between visit work, whether it's the nurse calling the patient to discuss medications or the medical assistant calling the patient to remind them to get a screening test or come in for a visit.
We now do what's called roster reviews, where we have the clinical team and we review patient by patient, patients who have certain medical conditions that we want to really make sure we're managing the best we can.
So what the AQC has allowed us to do is really to expand our focus on an already very strong infrastructure to make even greater improvements than we thought possible.
We've been looking at our total medical expense, and we have seen in the last year a bending of the curve and actually a reduction in the rate of increase significantly. I think our biggest accomplishment has been the intense focus on improving the quality of care that the AQC incents us to do. We're providing care much differently now than we did 3-4 years ago. That's really been a dramatic change.